Over 30 million people in the US take an antidepressant, making them one of the most widely prescribed medications in the country. Yet there is a massive disconnect between the massive volume of prescriptions and how these drugs actually function. Many people start treatment believing they've found a standalone, happy pill that will provide immediate relief from sadness. Clinical reality is much more demanding. These are serious biological tools that require an upfront investment of patience and a high tolerance for physical side effects. You have to decide if the physical cost and the delayed timeline are worth the eventual functional output. Misunderstanding this trade-off is the primary reason patients abandon treatment prematurely, which often leads to prolonged suffering. Antidepressants function on a purely biological level. They do not address the root psychological causes of depression or manufacture instant happiness. Their baseline function is to alter how the brain uses specific chemicals, neurotransmitters like serotonin, to better regulate mood and behavior. This process triggers neuroplasticity. Over several weeks, the brain begins physically rewiring itself by forming new connections between nerve cells. This physical rewiring improves the way various parts of the brain interact and work together, which is what eventually leads to mood stability. Think of the medication as a biological scaffold. It provides the structural support and capacity required for you to do the actual work of healing. That scaffolding takes time to build. You should expect a strict 4 to 8 week delay before the medication reaches full efficacy. Prepare for the side effect window. During the first 3 weeks, physical symptoms like nausea or sleep issues peak. Emotional improvement begins after this friction subsides. Notice the mood line rising between weeks 4 and 8 as side effects drop. Progress usually appears in subtle physical ways first. Notice changes in your appetite, your ability to focus, or your energy levels before you feel a lift in your mood. Quitting during the early side effect spike means you pay the full biological cost without ever reaping the psychological rewards. Navigating this onboarding phase requires viewing the medication as a long-term biological trial, not an instant painkiller. Finding the right drug is a process of trial and error based on your specific symptom profile. Providers typically start with SSRIs, like Prozac, as the standard first-line treatment. SSRIs are highly effective at boosting serotonin and generally have milder side effects, making them the safest starting point for most people. However, they do carry lifestyle frictions, such as potential weight gain, emotional numbing, or sexual dysfunction. If SSRIs don't work, your doctor may pivot to SNRIs, or atypical antidepressants, which target different neurotransmitters, like norepinephrine, to help with alertness and stress. Older classes like tricyclics or specialized NMDA antagonists are options for treatment-resistant cases, though they carry higher risks and require closer medical supervision. Switching medications is a strategic medical pivot, designed specifically to match a precise chemical class to your unique symptoms. While common side effects are usually mild, you must be able to recognize the rare but serious complications that require immediate emergency care. Serotonin syndrome occurs when too much serotonin builds up in your body, causing confusion, muscle stiffness, or seizures. You must also be aware of the FDA black box warning regarding an increased risk of suicidal thoughts during the early stages of treatment. This risk is highly monitored and most frequently discussed in patients who are 24 years old or younger. These risks are exactly why antidepressant therapy must be an actively supervised collaboration with your healthcare provider rather than a passive prescription. Because antidepressants don't address the root cause of depression, they are designed to be paired with talk therapy. Therapy equips you to resolve underlying psychological factors, while the medication provides the chemical stability necessary to do that work. Once you begin to feel better, there is a physiological danger in halting the medication abruptly. Stopping too quickly can cause discontinuation syndrome, a backlash of flu-like symptoms, dizziness, and sudden mood crashes. Exiting the protocol safely requires the same level of strategic medical planning and tapering as starting it. Deciding if this is the right strategic move depends on your commitment. This path requires a strict 6-month trial and behavioral therapy to achieve baseline restoration. Conversely, seeking a rapid, passive cure without addressing psychological factors guarantees a high risk of treatment abandonment. While these medications are not inherently addictive, they absolutely demand respect as a serious, long-term systemic medical intervention. Be patient with the 8-week timeline. communicate aggressively with your provider, and do the therapeutic work required to rebuild your future.